So my name is Ahmad Shadi bin Amran. So today I would like to present to you guys about my topic that is COVID-19 effect on our education system that is berbahasa Prof. Ayat Al-Bian. Okay, so this is our main objective for today. We can say introduction, pathogenesis, possible effect of COVID-19 on education system, and lastly the treatment. Okay, so for the first introduction is what is COVID-19? COVID-19 comes from coronavirus SARS-CoV-2 from family coronavirus genus B, and has claimed about 1 million total deaths worldwide. And based on meta study, the most prevalent signs and symptoms from infected person is fever and followed by cough. And the most prevalent comorbidities with COVID-19 are hypertension, that is 57%, and followed by diabetes, that is 9.1%. Okay, so how this started is mainly by start with droplet from infected person, and then the droplets stay in air or any context before it is carried by someone that touch it or inhale it, and it enter our body through our cavities. Okay, so for the introduction, how does coronavirus do in our body? Firstly, the virus life cycle begin when the yeast protein is in the virus binds to the yeast receptor, the protein which expressed in many tissue as its entry for in our cells. And then, what is the pathogenesis that can occur? Firstly, the pathogenesis of SARS-CoV-2. Firstly, there will be a cleavage of S protein that is triggered by transmembrane protease serine 2 and cathepsin. For the secondly, there will be clathrin-dependent and clathrin-independent endocytosis that may also involve in mediating viral entry. The third one, genome RNA, then released into cell and translated into viral replicase protein P1A and 1AB, and lastly, the virals are released via vesicles outside of the cells. Okay, so what is the possible effects on our endocrine system? Like I said before, all organs that contain abundant yeast2 receptor are at highly risk in getting infected. So our endocrine organs such as pituitary gland, testicle, bone, pancreas, adrenal gland, adrenal glands also are highly exposed to the COVID-19, to the SARS-CoV-2. So next, what is the pathology that we might see in infected person? Firstly, is central hypocortisolism. Okay, so for central hypocortisolism is due to entry of the virus inside our hypothalamus and cause degradation of yeast2 receptor inside our hypothalamus. And this also have the same molecular mimicry such as SARS-CoV-1 to ACTH back then in 2003. And for the manifestation, the patient would have post-viral syndromes as manifestation. So for the second pathology that we might see in COVID-19 and Omicron, pathology is hypokalemia. Hypokalemia occurs when there is gastrointestinal losses due to upregulation of renin angiotensin aldosterone system by degradation of yeast2, and the patient would have hypokalemia manifestation. And then for the third one pathology that we must see is hypoadrenalism. Hypoadrenalism occurs due to adrenal necrosis and vasculitis that from direct sympathetic effect of inflammatory response to our adrenal glands. And then the patient will manifest by having postural hypotension, persistently low blood pressure, and also maybe hypovolemia and hypokalemia. So for the fourth pathology that we might see is hypothyroidism. Hypothyroidism occurs due to dysfunction of follicular and parafollicular cells of the thyroid glands due to the ACE2 receptor cell-mediated injury. And then the patient will show manifestation of hypothyroidism such as lethargy, obesity, and hypothermia. So for the second last pathology that we have seen is hyperglycemia. This occurs when there is direct viral injury on yeast2 expressing cells of our pancreas. And then the patient will manifest by having a mild pancreatitis or hyperglycemia, and also maybe asymptomatic. And for the last pathology that we might see is hypogonadism. And hypogonadism occurs when there's entry of the virus into our spermatogonia and cause disruption and cause decreased number of spermatozoa released and may cause subfertility in males. Okay, this is the management of the stated pathology, but I will not talk about the management because this is not our my main objective for today. Okay, so lastly, the take-home message from my presentation is this recent study shows that coronavirus do have infection with ACE2 receptor as well as in our body tissues, and endocrine disorderation condition with pre-existing morbidities seen worsen as a result of COVID-19. Okay, so that's all my content for my presentation. This is the picture of us in doing elective practical in accident and emergency department in Malaysia, and this is my picture in COVID-19 center in Malaysia.